Warning signs and symptoms of prostate enlargement, BPH. Prostate enlargement, medically known as benign prostatic hyperplasia, BPH, is a common condition among men, especially as they age. The prostate is a small, walnut-shaped gland located just below the bladder and in front of the rectum. It surrounds the urethra, the tube that carries urine out of the body. The primary function of the prostate is to produce a fluid that nourishes and transports sperm during ejaculation. As men grow older, the prostate tends to increase in size. This enlargement can press against the urethra, leading to a variety of urinary and other symptoms. Although BPH is not cancerous, it can significantly affect a man's quality of life by interfering with normal urination and other bodily functions. If left untreated, it can lead to complications such as urinary tract infections, bladder stones, and even kidney damage. Understanding the signs and symptoms of prostate enlargement is important for early detection and management. In this video, we will explore the common signs and symptoms associated with prostate enlargement and discuss how they can impact men's health and well-being. 1. Frequent urination. One of the hallmark symptoms of prostate enlargement is the frequent need to urinate, especially during the night. As the prostate grows larger, it can squeeze the urethra, causing a partial blockage of the urinary flow. This means the bladder has to work harder to push urine through the narrowed passage, resulting in the frequent urge to urinate. Frequent urination can disrupt daily activities and can significantly impact sleep quality. Many men with BPH find themselves waking up several times during the night to use the bathroom, leading to sleep deprivation and fatigue. In some cases, even after urinating, the sensation that the bladder has not been completely emptied may persist, causing men to feel like they need to go again. 2. Urgency to urinate. Along with frequent urination, men with prostate enlargement often experience a sudden and intense urge to urinate. This symptom, known as urinary urgency, can come on abruptly and be difficult to control. In some cases, the urgency may be so severe that it leads to urinary incontinence, which is the involuntary leakage of urine. Urinary urgency can be especially bothersome because it can interfere with daily activities, such as work, travel, and social events. The constant need to be near a bathroom or the fear of leaking urine can cause anxiety and embarrassment for men suffering from BPH. 3. Weak urine stream. A weak or slow urine stream is another common symptom of prostate enlargement. As the prostate enlarges and presses on the urethra, the flow of urine is obstructed, leading to a reduced and weak stream. Men may notice that it takes longer to urinate and that they are unable to fully empty their bladder in one go. This symptom is often accompanied by a feeling of incomplete emptying, where men feel like they still need to urinate even after finishing. A weak urine stream can also make it difficult to start urinating, a symptom known as hesitancy. Hesitancy occurs when the urinary flow is delayed or difficult to begin, often requiring men to strain or push to start the stream. 4. Intermittent urine flow. In addition to a weak urine stream, men with BPH or enlarged prostate may experience intermittent flow, meaning that the flow of urine starts and stops during urination. This stop and start pattern can be frustrating and uncomfortable, as it can take much longer to fully empty the bladder. Intermittent flow is caused by the uneven pressure exerted on the urethra by the enlarged prostate. As a result, the bladder muscles have to work harder to push urine through, and the flow may be disrupted. Men with this symptom often have to strain or bear down to try to maintain a steady flow. 5. Incomplete emptying of the bladder. A frequent and frustrating symptom of BPH or enlarged prostate is the sensation of incomplete bladder emptying. Men with prostate enlargement often feel like they still need to urinate even after just finishing. This feeling can occur because the bladder is not able to fully expel all the urine due to the obstruction caused by the enlarged prostate. Incomplete emptying can lead to residual urine in the bladder, increasing the risk of urinary tract infections and bladder stones. Over time, if the bladder is consistently unable to empty completely, it can lead to bladder dysfunction and an increased risk of complications like kidney damage. 6. Blood in the urine, also known as hematuria. In some cases, men with an enlarged prostate may notice blood in the urine, a condition known as hematuria. Blood in the urine can appear as pink, red, or brown discoloration, or it may only be detected through microscopic examination during a medical test. Hematuria can occur due to irritation or damage to the blood vessels in the bladder or urethra caused by the enlarged prostate. Although hematuria is not a common symptom of BPH, it is important to seek medical attention if blood in the urine is observed, as it can also be a sign of more serious conditions such as bladder cancer, kidney stones, or urinary tract infections. 7. Pain or discomfort during urination. Men with BPH may experience pain or discomfort during urination, known as dysuria. This discomfort can range from a mild burning sensation to more severe pain, particularly at the beginning or end of urination. Dysuria is often caused by inflammation or irritation of the bladder or urethra due to the enlarged prostate pressing on these structures. Painful urination can be a sign of other underlying conditions as well, such as urinary tract infections, prostatitis, or inflammation of the prostate, or bladder stones. Therefore, it is important to consult a healthcare professional if this symptom occurs. 8. Urinary retention. Urinary retention is a more serious and potentially dangerous complication of prostate enlargement. It occurs when the enlarged prostate blocks the flow of urine so severely that the bladder is unable to empty at all. This can cause a sudden and painful inability to urinate, known as acute urinary retention, or it can develop gradually over time as chronic urinary retention. Acute urinary retention is a medical emergency that requires immediate treatment, as the buildup of urine in the bladder can cause damage to the bladder muscles and kidneys. Symptoms of acute urinary retention include severe abdominal pain, a strong urge to urinate, and an inability to pass urine despite straining. Treatment usually involves the insertion of a catheter to drain the bladder. Chronic urinary retention, on the other hand, may not be as immediately painful but can still lead to serious complications if left untreated. It can result in frequent urinary tract infections, bladder stones, and damage to the kidneys. 9. Lower abdominal or pelvic pain. Some men with prostate enlargement may experience pain or discomfort in the lower abdomen or pelvic area. This pain can range from mild to severe and may be associated with urinary symptoms such as difficulty urinating or incomplete emptying of the bladder. Lower abdominal or pelvic pain is often caused by the pressure exerted by the enlarged prostate on surrounding structures, such as the bladder and urethra. In some cases, this pain can also radiate to the lower back or groin area. While pelvic pain is not always a direct result of BPH, it can be a sign of complications such as prostatitis or bladder stones. 10. Sexual dysfunction. In addition to urinary symptoms, prostate enlargement can also affect sexual function. Many men with enlarged prostate report experiencing erectile dysfunction, a condition in which they have difficulty achieving or maintaining an erection. This can be due to the physical pressure exerted by the enlarged prostate on nearby nerves and blood vessels that are involved in erectile function. Furthermore, BPH can lead to reduced sexual satisfaction or difficulty with ejaculation. Some men may experience painful ejaculation, while others may notice a reduction in the volume of semen produced during ejaculation. These symptoms can affect a man's sexual health and quality of life, leading to frustration and stress. If you experience any of the symptoms described in this video, it is important to seek medical advice and discuss treatment options with your healthcare provider to maintain your health and well-being. Early detection and management can significantly improve your quality of life. That's it for today's video. If you found this helpful, give it a thumbs up, and don't forget to share it with someone who might benefit from this information. For more tips on health and wellness, make sure to subscribe to Vitality Unplugged.